Your face is the one thing you cannot undo. This is the most popular cosmetic procedure in Hollywood right now. Half the celebrities you follow have had it done, and in 20 years, most of them are going to regret it. Buccal fat removal. It's cheap, it's fast, and it gives you cheekbones at 25. The problem is what it does to your face at 45. Here's what buccal fat pad removal looks like in 20 years. I'm Dr. Sam, the Reconstructor. I'm a board-certified reconstructive surgeon, and this is the procedure I get asked to reverse the most. With the use of GLP-1s like Ozempic on the rise, the 90s heroin chic look is back. And while more and more celebrities flaunt the gaunt, rumors are flying about the most popular procedure in Hollywood, with A-listers chasing the look du jour of pronounced cheekbones and near skeletal features. But while buccal fat removal is fast, cheap, and effective, it's also permanent, which means those cheekbones on display at 25 will age into something much different by 45. So what exactly is buccal fat? It's a fat pad that sits right in the middle of the cheek. It sits between the cheekbone and the jawbone, and it gives you a younger looking, more full face. The actual anatomy, the fat pad has 3 separate lobes to it sitting in this area and sending fingers up and down. As part of that, accessing it from inside the mouth is very easy. So the surgical procedure, the surgeon goes from inside, we make a small opening, that fat pad can be identified and removed. It is not without risk. There are a lot of muscles in that area, as well as if you get too deep, which would be more closer to the outer surface of the cheek, there are lots of nerves in that area, as well as the parotid gland and the ducts that you need for the salivation of your mouth. So, like everything in surgery, it's not risk-free, but done under the right hands can be done in a simple approach with relatively low risks in trained hands. The problem with doing a fat pad removal is once that fat pad's out, it's gone forever. So, what happens with normal aging in the face? There's facial descent. The fat pads that are up high, the malar fat pads, get descending down. So, how do we reconstruct and fix this problem becomes really complicated. Why is it popular? Obviously, the media has made it very popular, but from a surgical standpoint, it's a quick procedure, little downside, and in obviously trained hands, low risk. Here's what nobody tells you before this procedure. The buccal fat pad does not grow back, and your face naturally loses volume as you age. So when you remove the volume from a face that's going to lose volume on its own over the next 20 years, you're not just sculpting, you're accelerating the aging process and magnifying that gaunt, atrophied look. You can already see it happening in real time. Chrissy Teigen is one of the only celebrities who's publicly confirmed she had buccal fat pad removal.
That Dr. Diamond buccal fat removal thing here, I'm really seeing the results, and I like it.
How can you identify and what are the landmarks you're looking at when you see someone? It's simple. Start with their cheekbone or the zygoma, the zygomatic process, and then their mandible or jawbone. There's a normal contour here and that fullness that's the normal part of our face. The fat pad sits right in the middle. So on people that have had it removed, they'll have that gaunt look like that, where it's a sucked in appearance. Now, in Chrissy Teigen, we can see a change where she had a full face, and now she's got that gauntness or that lack of fullness between her cheekbone and the jawline, which makes the cheekbones look much more pronounced than they were in the past. Chrissy Teigen's one of the least dramatic. Some of the other celebrities we're going to talk about are even more significant of a difference. Lea Michele, Bella Hadid, Dove Cameron, these are some of the other faces that we see dramatic differences on these celebrities. And the same thing, they go from having that normal fullness of their face to now the gaunt, sucked in look. What are the consequences? They get immediate cheekbones, yes, but they also look 10 to 15 years older immediately. That may seem appealing right now when they're in their early 20s, but as they start to age and get into their 40s, 40-year-old doesn't want to look like they're 60. So that's where we talk about the permanence of this procedure and the lack of reversibility. Social media and the world that we live in now has changed the perception of reality for most people. Part of the driving force behind this could be the Kardashian and Jenners. The problem becomes when we have 10-year-olds and our teenagers chasing these celebrity looks and thinking surgery is what they should be doing and going for that dramatic look that can only be achieved with surgical procedures. Here's what none of these celebrities are showing you. The cheekbones that looked sculpted at 25 look sunken at 45. The skin that draped beautifully over the angular bones now sags into hollows created by the surgical procedure and very difficult to correct. Even our best filler techniques and other surgical techniques can't reverse the loss of that fat pad. What happens when a patient comes in and wants to have a reversal or correcting the consequence of removing the fat pad 5, 10, 15 years ago? We're not seeing much of that now, but 20 years from now, a lot of these people are going to be coming in and asking for corrections or reversing the effect of what they did with the removal of the buccal fat pad. So, as we have descent and atrophy of the face, one of the things we can do to help with that is some filler. A lot of that will go into relifting and suspending the malar fat pad that's still intact. That's the cheek fat. That can be done with a little bit of filler placed directly underneath to re-elevate it. That will help resuspend some of the skin over the face. It'll help the jowling that happens when skin falls down here, as well as the nasolabial folds. All of this together with a little bit of filler can be helpful. It is impossible to reverse by putting the fat pad back in. So what happens in my practice when a 24-year-old comes in and asks for buccal fat pad removal? Well, we start by discussing what their goals are and what's the best way to achieve that without something that may have down the road long-term consequences that are undesirable. And there are often different things, techniques that we can do using radiofrequency, microneedling, deep tissue therapies to improve them, or even in extreme cases, liposuction that creates a small little hole and do it. The idea of doing something permanent with removing of a buccal fat pad, I am not the greatest fan of because of the permanence and the lack of reversibility. If you take one thing away from this video, it is this. The most popular procedure in Hollywood is not always the best procedure for you. Talk to a board-certified surgeon who will give you an honest answer, not just the answer you want to hear. I'm Dr. Sam, the Reconstructor.